Hi, my name's Chad, and I'm from the 2015 Hartnell VN program, and today I'm going to be demonstrating a Foley catheter insertion on a female. First thing you want to do is get a doctor's order, and you want to just verify or make sure if the patient has any allergies to betadine, latex, or any adhesives. And then you're going to go into the room and you are going to explain the procedure, and you're going to position the patient to a dorsal recumbent, which is basically the same position that a woman in labor is going to take. Make sure that the bed is at the proper height so that it's easier for you to work, proper lighting, and then you might want to also have someone there with you to assist you in the procedure. So we'll gather all of our supplies, and there's usually a supply kit or a catheter kit that most, if not all, of the supplies for the procedure is going to be in here. And when we open this, we're going to go through them one by one. Okay, so I'm going to come into the room, knock, introduce myself. Hi, Mrs. Smith. My name's Chad. I'm the nurse today, and we're going to insert an indwelling catheter. And there are a few reasons that a Foley catheter is indicated for. You might have urinary retention or some kind of bladder obstruction. Okay, so I'm going to verify the patient's identity. Mrs. Smith, can you do me a favor and state your last name and your date of birth for me? Okay, and then, so I've done that. I'm going to provide for privacy, so I'm going to draw the curtains. This, by the way, before I put anything on the table, because I'll be needing this table, I would have wiped this down just to make sure that this is a clean surface, because you'll need this to open your sterile gloves. Hand hygiene, obviously. I would have done this first, the very first thing that I do when I enter the room as I'm introducing myself. And then I want to again position her. Well, tell her that I'm going to be pulling down the sheets, and then the mannequin is already positioned in the dorsal recumbent position. But again, this is where your help comes in if you need it, if they need help propping up their legs or to position your supplies, this is where they come in. So you take your kit at this point, and you would position it right here, right around the lower leg portion of the bed. That way when you open it, the inside of this wrap will actually be part of your sterile field. You want to do any perennial cleaning at this point if you feel like you need to. Obviously you'd be wearing gloves for that, but let's just say that she's ready to go, and again, I've verified that she doesn't have any allergies to any adhesives or betadine or latex. Okay, so the way to do this is, again, this is your packet of supplies. You want to open this flap first, away from the patient, and then again, you really want to adhere to the principles of sterility. The inside of this is going to be a sterile field. Okay. So that came back down. The sterile gloves are going to be most of the time at the top of the package. You'll take that out. You'll open it here on your clean surface. And just want to make sure that it's right side up, left and right. And then these flaps right here, they're a good place to grab so that you can open the package. Again, I'll show you that one more time. Usually it's kind of folded like that, but you just want to make sure that you're kind of straightening it out and it doesn't fold back on you, because you'll just be making it harder on yourself. And then you'll start with your you'll glove first your dominant hand. So I'm right-handed. I would, with my left hand, take the right glove by the lower part or the inside part of it, and kind of like a crane, okay, lift it up and then take a step back. Again, principles of sterility, I don't want to lower it beneath my waist. I'll carefully stick my right hand and fingers in there. I want to make sure that I do not touch the outer part of that glove, and I've maintained sterility. I want to keep it like in my line of sight here, and then with my gloved right hand, I want to get in the left glove, work my fingers in there, inside that, pick it up, and then work my left hand in there, making sure to get my right thumb out of the way. And I maintain sterility. Okay, so at this point I'm still sterile, and everything in this box is still sterile. I'll grab this and I'll open this up, and this is the thing that you want to use or place underneath the patient's backside. And what you want to do is make sure that the shiny side of this goes into the bed, or on the side of the bed. And so you want to protect your sterile gloves or your sterile hands by kind of doing this number right here, and then telling the patient to lift her backside, okay? And then you would place it there. You would then take the top tray, position it there. At this point, you take the syringe with the normal saline, take the cap off, okay. Just drop that, and you would insert it into this port right here, and then kind of just put that right there so that that's ready. At this point, I like to pull the plastic part or the plastic covering off the catheter tip a little bit, so that it's easier for me to maneuver once I get to that part, and it'll make sense once I get to that part, but I'll just kind of leave that there. And then this will be, it'll probably say in your kit hydrogen peroxide, but in reality you'll be using betadine again if there's no contraindication, they're not allergic to it. I'm not going to open it, but you would open this and people would pour it on the cotton swabs, or right to the side where they can, you know, dip their cotton swabs in it. Set that aside, and then at this point you would open your lube and pour that into another part, so that you would dip your catheter tip into that mound of lube. Set that aside, and again, I'm still sterile. You're going to contaminate your one hand, and I like to use my ring finger and my thumb to open the labia minora and the majora. So you really want to kind of get everything out of the way. Again, at this point, my right hand is contaminated. You want to maintain this position throughout. Grab the forceps, and then grab your betadine soap swabs, and you start with the sides. You go one swipe down, drop it right there. Grab the next cotton swab, the other side, go down, drop it, and then again, this is the mannequin is going to have a tough area here, so you'll see me kind of struggle with it as you will experience, but actually in real life it's going to be a lot tougher too, because it's going to be slippery and all that, but you just really have to make sure that you're holding as best as you can. And then the last swab, you'll go straight down the middle, and you really want to make sure that you're wiping well. Okay, and then just drop that. At this point, you grab the catheter tip, and then you want to make sure that you're not flapping around here, but the idea is to get the plastic part out of the way, okay? And so that you have a little bit of control, just kind of work that like that, okay? You're still sterile, okay? And you're exposing this part, about this much of the catheter tip, and you would, right? Okay, so I'm coating the tip of the catheter with lube, and then again I would be holding this in place. You would be advancing until you see urine come out, and then after you see the urine start to flow, you would advance it about an inch, maybe an inch and a half, maybe even 2 inches in. It's better to be safe. It's just going to coil in there, and then once you're confident that enough of it is in there, you would then hold. And at this point you could introduce or you could inflate the balloon with the saline. Okay, at this point you can let go and then detach right here. And as you're taking the bag out, you just want to make sure that it's not, obviously you have to maneuver it a little bit, but make sure that it doesn't go above the level of where the bladder is. Usually there's a way to secure it on the patient's leg. It's going to be like a lock thing to an adhesive right here to just kind of keep it in place. You would make sure that there aren't any kinks to the tube, and you'd make sure that it's in a place where it's not going to be it's not sort of in the way. Like, you want to consider, for example, when you're getting the rail up or getting it down, you just want to be mindful of where exactly you're hanging the bag. So, get this back down. All right, and you're just going to clean up right after. You're going to assist your patient to a comfortable position. You're going to leave them with the call bell, and you're gonna legs down, and again you're gonna help them to assume a more comfortable position. You're gonna make sure that before you leave the room, you're lowering the bed to the lowest possible position. You're gonna ask them if there's anything else that you can do for them. Again, the call light is within reach, and that should be it.